Good evening, you're watching The Big Story with Olivia Quay. I'm Haryanto Diman.
A team of Singapore General Hospital doctors has developed a transparent and safer booth system which provides extra protection for healthcare workers doing large-scale COVID-19 tests. Called Swab Assurance for Everyone, or SG Safe, it's a foldable three-panel transparent booth that comes fitted with a pair of biosafety level 3 gloves. With this system, the healthcare worker doesn't need to wear personal protective gear since he's protected behind the booth.
Both the Defence and Health Ministries have debunked messages circulating on social media looking to recruit staff to work at foreign worker dormitories as well as the community isolation facility at the Singapore Expo. In a Facebook post yesterday, MINDEF said it is hiring former Singapore Armed Forces regulars to support the dormitory management, but the recruitment messages asking for personal particulars are fake.
The Health Ministry reported a daily high of new cases yesterday, with 728. The total number of people infected has crossed the 4,000 mark. The count now stands at 4,427.
Foreign workers living in dormitories continue to account for most of the new cases, making up 654 yesterday. The total number of confirmed cases linked to dormitories now stands at 2,689, more than half of all cases. The Health Ministry also confirmed 5 new dormitory clusters yesterday. They include 2 large purpose-built dormitories, Westlight Mandai and the Leo Dormitory in Kaki Bukit. The other 3 new clusters are linked to factory-converted dorms. 3 more dorms were also declared isolation areas, bringing the total to 12.
The cases in the dorms have climbed exponentially due to the high density of people living in close proximity and sharing living and sleeping spaces. Now, these factors are similar to other weak links in Singapore's battle against the virus, like nursing homes, childcare centres and preschools. But now let's take a closer look at the dorms, which are seeing a rapidly rising number of people with the virus. Joining us for this discussion are Mr. Alex Au and Dr. Leong Hoe Nam. Alex is the Vice President of an advocacy group for migrant workers, TWC2, which stands for Transient Workers Count Too. And Dr. Leong is an infectious diseases physician from the Rophi Clinic at Mount Elizabeth Novena. So Alex, let's start with you. The Ministry of Manpower has stepped up measures to contain the spread of the virus at the dorms. For instance, moving about 7,000 foreign workers into alternative living areas like military camps, floating hotels and vacant HDB blocks, and social distancing measures to minimize workers' interaction, which include providing meals to avoid communal cooking. Medical support is also on hand. Are the current measures helping, you think, and what more can be done?
Current measures may not be adequate, as you can obviously see from the fact that infections are climbing very rapidly. And I think we really need to look closely at what exactly those measures entail. There's a lot of talk about social distancing in the dormitories, but mostly focused on the common areas on the ground floor, in the dining room, and so forth. And at the same time, there are these strict rules about workers having to stay in their rooms itself, right? So what that means is that your social distancing rules apply to maybe 2 hours of a day when they are able to mingle in the common areas or move around. But for 22 hours of the day, they all have to be in their rooms, and they're going to be in close proximity with maybe 10 other, 12 other, or 20 other people in close proximity every day for 20 to 22 hours a day. So I'm not sure why we still think that these rules represent social distancing. There's going to be obviously going to be some transmission going on when you're in the same room with 20 other people, and we're talking a pretty small room here. So we should be very careful about transposing middle-class assumptions from Singapore-type families living in HDB flats where you are 1 or 2 persons in a bedroom into a dormitory situation. And, so we have been arguing that, you really have to move people out because the dormitories themselves, the rooms, are not really safe spaces anymore. We think of home as safe, but when your home is on fire, you don't tell people stay at home. You tell people get out. So we have to think in terms of moving lots of workers out in order to reduce the density. Now, you've mentioned a figure of 7,000. Yes, I heard that figure too 2 days ago. And frankly, when we know that there are 300,000 workers staying in various dormitories of various kinds, 7,000 is 2%. It doesn't make much difference in the density at all. So I don't think that this is going to be sufficient, you know? And when they move them out, are they tested before they move them out? If not, things can get worse. We don't know the answer to that question.
Right. Well, Dr. Leong, let's bring you into the conversation. What are your thoughts on the current measures?
Now, the current measures can be improved further. I'm going to discuss it in terms of the medical side of it. Like Alex, I agree with him that if we try to put all of them inside a dormitory again, we still have transmissions to 10 to 12 people. And ideally, you want a room which is just only 1 to 3 others so that the risk of transmission further will be cut down. But if you think about it, with 200,000 workers out in the dormitory, to actually find accommodations for them overnight or just even within 3 to 4 weeks, it is a big, big, tall order. I can't even possibly imagine how this can be done. The second thing which I would like to see, if it's possible from the medical perspective, is to actually screen workers now, even though if they may be asymptomatic, have no fever, have no cough. Now, we know for a fact that there are many people who are asymptomatic and they may pass infections, and in turn, they may spread the infection further when they go to common areas. Number two, we have heard stories of migrant workers who are not reporting sick even though they're unwell because they don't want to be taken out of the dormitory, put into the hospital, put into some form of quarantine because it will be a withdrawal of their privileges. I can empathize with them, but they must also see the bigger picture of preventing the spread within the dormitory as well as within the whole Singapore. So there's a greater good, there's a greater sense of work which we need to do, which is for the whole Singapore. Now, which means that in effect, we would have to screen each and every one of the help of the dormitory of the foreign workers there are. We may have to do an entry as well as do an exit PCR, which means 200,000 times 2, 400,000 PCR. That's a major tall order, huge amount of resources to implement it. And mind you, we are a small country which is fighting for all these reagents amongst the big players, including Germany, USA, and Korea. Will our requests for reagents get fulfilled? That's another issue. So not only do we have our own desires, as well as the needs of the individuals, the needs of the foreign workers as a whole, but as well as what we can actually provide realistically on the ground. Big tall order, Ministry of Health and Ministry of Manpower.
Well, both you gentlemen mentioned moving the workers out of the dormitories. 19 of the 43 purpose-built dorms are active clusters. 12 dorms are now gazetted as isolation areas, and workers there have to be quarantined for 14 days. So there are calls to find alternative accommodations for the workers. But Dr. Leong, let's go to you first. What is realistic and feasible to achieve this?
I think it's really, really difficult. Think about trying to get accommodations for 200,000 people. You need about 2 or 3 per person, 2 or 3 per room. So that works out to be at least 70 to 80,000 rooms all of a sudden. I think it's very difficult. And even if you can, you are going to go to a room which is not purpose-built for that, and you don't have your own comfort measures. And mind you, they will have to remain locked up inside the room totally. I think it's really challenging. So going forwards, if we were to think about it, when they actually finish, when the whole COVID-19 finishes, then do we actually need to think about these accommodations, future accommodations? Will there be enclaves and build up of foreign workers in certain regions? And this will create a massive dormitory-like effect for the whole group as such. And in fact, we are moving the whole dormitory effect to a HDB estate or another estate. So we're back to square one. Mind you, they also have their own cultural needs. They want to partake meals together. They want to do things together. And when you actually do that, you allow the virus to spread. Can we get the information across? The need to social distance, the need to stay away. Come on, they are human beings. They need contact. They need emotional support as well. So it is really a big tall order, and I'm not even sure if I'm the right person to answer this.
Well, Alex, would you like to weigh in? How feasible is it to actually move these workers to alternative accommodations?
I don't think we have exhausted all possibilities. We have suggested, for example, using all the available car parks in Singapore. If you imagine, we must have thousands and thousands of car park lots in all sorts of multi-story car parks, especially in shopping centers, which are largely deserted nowadays. We could very well commandeer all of these car parks, including the massive car parks at the airport. And we have the whole Terminal 2 at Changi shut down totally, which means we have huge holding rooms, which are designed very securely. If we really made an effort and used all these resources, I think we can move tens of thousands out. Because I'm sure there are thousands and thousands, more than tens of thousands of car parks in Singapore which are underutilized right now. It's an enormous logistical effort, which is why TWC2, realizing that, called for very early planning and very early action to get these places ready. It's a bit of a pity that we're sort of like, I think, taking half measures at this point. As far as Dr. Leong's point about the need to be social and all that, that's true of Singaporeans as it is of other communities. But I also noticed from our work with migrant workers that they are just as understanding of the virus danger at this time. And in our operations, when we work with migrant workers and we ask them, you queue up nicely and you don't crowd around and you talk at a distance with each other, they understand and they abide by the same standards. So during this time, they understand, and I think we can trust that they too will be as equally responsible as Singaporeans. Obviously, after the COVID crisis is over, Singaporeans will socialize again, and they will want to socialize again. They'll want to have their film shows and their dances and the club nights. Well, we'll see whether the world changes totally after that, but they're no different from Singaporeans.
Dr. Leong, back to you. Now, yesterday we had a professor from the Sosui Hawk School of Public Health on the show, and he said it's reasonable to expect the number of dorm infections to hit 10,000 to 20,000 by the end of April. So if indeed the number of cases from the dorms reaches 5 digits, can our healthcare system cope, you think?
Yes, I think it can still cope for a few reasons. Number one, the 10 to 20,000 figures, honestly, is actually very realistic. But the good thing is many of them, the bulk of them, are actually in good health. And their age is actually good. Again, they are much younger than me, which means the chances of them requiring intensive care or added special care will be very, very slim. So it will be unlike the proportion which we see in nursing home who fall sick, or even the SAFRA Jurong, those people who fall sick. They are talking about different age group and hence better outcome. With a different age group, then their demands on medical care will be much lesser. In fact, they can be nursed in expo with no minimal or no supervision at all. Now, what it effectively means is the real medical care will be concentrated to a small number of people, perhaps just 1 to 10% of them, and we can actually cope with them. How else can we cope? How else can the hospitals do? Elective surgeries have to cut down, and this is a part where Singaporeans have to understand where to give us some of the luxuries which we are used to. See a doctor for a knee replacement and have it scheduled the next day. No, this doesn't work. We have to give up some of this for our foreign workers who have actually worked so hard for us. Number three, even private hospitals can take up the added job. They can take on the patients who are relatively sicker and look after them in the private hospitals. After all, we are talking about more vacancies now with the lack of foreign patients coming into Singapore. Now, if Singapore thinks broadly, not just in government hospitals, but the whole Singapore and all the resources of healthcare system is placed under the care of the Ministry of Health, in inverted commas, placed under the care, then together we can actually overcome COVID and our system will not be strained.
Right. Well, Dr. Leong, you mentioned that the majority of these foreign workers are generally in good health. So does it mean you expect the majority of them, now there are more than 2,600 infected foreign workers, So do you expect the majority of them to fight off the virus?
Yes, I expect most, if not all, to fight off the virus. Okay, they have something which you have, which is youth. As for myself, I could end up on the poorer end of the spectrum, but they are going to do good. They are going to fight it off with little or no reactions. And in fact, they will have immunity thereafter. And this will come in handy in future outbreaks. So I will be, should they fall sick, I think they will do reasonably well. And they will be cared for in Singapore with good top class medical care.
That is a very optimistic note. Alex, could you share with us what you have been hearing from workers affected by the recent safe distancing measures and how your organization, TWC2, is helping them?
Well, I just want to add one quick point to what Dr. Leong has been saying about their general health. It is true that foreign workers are of a younger demographic compared to me, for example. But right now, they are under such severe stress. And for years, there's always been a nutrition problem with foreign workers. They've been getting rather bad diets. And we're just wondering, I mean, I'm no doctor, but we're just wondering to what extent does that affect their immunity, especially now that they're under even more stress with worries about salary and confinement, and maybe they may not get along with their roommates and things like that. But anyway, so let's move on. What are they feeling there? The sense we get, and we're talking to a lot of workers who are able to reach us through the phone and through WhatsApp. The sense we get is that they are feeling rather trapped. All right, they're feeling rather abandoned. Now, that's a feeling that's natural when you're kept in a room for 22 hours a day. They also report that it's not easy for them to reach out to us. Despite what the Ministry of Manpower wishes, many dormitories still do not have Wi-Fi. At least the bandwidth, for example, is not enough to cope with so many workers wanting to be online. So there are these problems of connectivity, or they can't get the entertainment on their phones. There's nothing to do. It's very boring. And then, of course, they just feel trapped. And there was one worker who basically said, you know, what are we doing here? We're just waiting for the virus to come and take us. And that's the kind of attitude that I think doesn't do very much for mental health. Then there are other workers who we've been helping before, but even now, like they've been injured at worksite accidents. And they need continuing care. Like we have some workers who need continuing supply prescriptions of painkillers. And the system has basically become very defective now because they can't go out to their follow-up appointments in the hospitals. They're in a quarantined dorm, but their prescriptions are running out. They have no more painkillers. So pain is going to come back again. What do? There is no clinic in the dormitory. And they can't reach out to anybody except maybe to us. And we try our best to reach out to other NGOs and see who can deliver a bit of painkiller to the poor guy. And of course, they worry about their salary. So they have all these worries. You know, many of them have not received their salary for the month of March. And they worry, you know, going forward, will they have work? If they don't have work, will the employer have cash flow? If the employer doesn't have cash flow, will they get salary? So all these things just pile on. They are under severe stress and they feel quite abandoned.
Well, you have left us a lot of food for thought. We've been speaking to Alex Au, Vice President of Advocacy Group TWC2, as well as Dr. Leong Hoe Nam from the Rophi Clinic. Gentlemen, thank you so much for your time.
Welcome.
Thank you.
On the global front, China revised its official death toll count from COVID-19, adding 1,290 deaths in the former epicenter of Wuhan. This is a 39% revision and brings the nationwide death toll to almost 4,700. Meanwhile, the country continues to refute claims that intentionally underreported its numbers.
Confusion over the number of fatalities has also surfaced in Spain as the death toll soared past 19,500. Regional authorities in Madrid and Catalonia said that each had thousands more victims than the official count, which some say doesn't include those who died outside of hospital.
Over in the US, President Donald Trump has unveiled a staggered three-stage approach that US state governors could enact to help revive the American economy. In the first phase, groups of more than 10 people should be avoided if appropriate distancing measures are not practical. In the second phase, in states with no evidence of a rebound in cases, groups of more than 50 should be avoided where social distancing isn't practical. Non-essential travel can also resume in this period. Phase 3 would include unrestricted staffing of workplaces.
Republican lawmakers echoed President Donald Trump's criticism of the World Health Organization over its handling of the pandemic. 17 Republicans wrote a letter to Mr. Trump expressing their support for his announcement to withhold funding aid to the WHO until its Director General Tedros Adhanom Ghebreyesus resigns.
Let's bring in our US Bureau Chief Nirmal Ghosh into the conversation. Nirmal, it's another rollercoaster week for the Trump administration. Aside from freezing funding to WHO, President Trump claimed and then backed away from an assertion he had total authority to lift restrictions. He also threatened to shut down both chambers of Congress in order to fill vacancies in his administration. No president has done this before. Is it likely to happen?
It is very difficult to do because there is a process. So right now, Congress is in recess. Senate Majority Leader Mitch McConnell would have to bring the Senate back and they would have to vote to adjourn. Then Speaker Nancy Pelosi would have to bring the House back and the House would have to also vote, and it is of course highly likely they will vote against the Senate's resolution, or she could just sit on it, leaving it in limbo. But assuming the House rejects it, then the Senate would have to disagree, and only then can President Trump actually adjourn Congress. The Senate basically creates the conditions, the rationale for the president to take this action. But then it would also be challenged in the Supreme Court. None of this has ever happened. So if this process does start, it would most likely be eventually adjudicated by the Supreme Court.
Individual US states are facing an agonizing decision over jobs versus health. This week has seen protests in Michigan and Ohio demanding the reopening of businesses. President Trump put forward May 1st as a grand reopening, suggesting some states could even open earlier. Are many states likely to reopen in the coming two-week window?
I think by May 1, we may see more than a dozen states lifting stay-at-home orders and allowing sectors like restaurants, shops, and entertainment to resume normal business, but with some precautions and subject to close monitoring. Now, the key to this is, of course, the surveillance. They must have adequate testing and quick testing. Until recently, it took a couple of days, if not more, to get the result of a test. Now there is a much faster test. You get the result in minutes. And there is also a saliva test, which is equally quick. The key is to widely deploy them, and they have to be geared for very quick detection and contact tracing, so they can isolate people and places if necessary if COVID-19 cases emerge. We may see perhaps 19 or 20 states opening up in this manner by around May 1, the ones that are not so badly hit. Midwestern states may be among the first. Ohio Governor Mike DeWine today said the state will open up on May 1. Likewise, Michigan, Illinois, Wisconsin, Indiana, maybe Kentucky, maybe Alaska in the north, maybe Alabama in the south, maybe parts, if not the whole of California. But again, under some form of social distancing. And what is interesting and very good is that governors of adjacent states are conferencing and coordinating strategy, which is very important, as no one state can function in isolation.
Internationally, President Trump announced the suspension of US funding pending a 60 to 90-day investigation. Formerly, the US has been WHO's biggest donor. How worrying is it that the US is now distancing itself from the efforts to fight the pandemic, and will there be further repercussions?
Well, it is worrying because we are in this current crisis and you don't want to undermine the WHO's capacity. The WHO is also working on other issues, Ebola in the DRC, the Democratic Republic of Congo, and that has been successful. Now there is wide agreement that the WHO has been taking a sort of quiet approach, a softly approach with China, maybe in return for access, at a time when the US wants a more aggressive approach. That it does not allow Taiwan to engage is one indicator of this. So that brings us to the geopolitics. The WHO is caught in the middle of a blame game, a worsening US-China confrontation, and an increasing effort in Washington to deflect attention away from the Trump administration's early failings. Blaming the WHO and of course China is also a winner with Donald Trump's base. It also conveniently fits in with the administration's allergy to multilateral institutions, which it feels the US has been bankrolling with little or no benefit to the US. Certainly this leaves the WHO in a weak position. Not that it was in such a strong position anyway, but now it risks being even more considerably weakened. Now this may also leave China and possibly others with an option of stepping up to the plate and giving the WHO more money to keep it funded. But that may not address the problem of the WHO being soft on China, and the US would continue to question its effectiveness until it undergoes major reforms. Generally speaking, in the near term, not such a good thing when you are fighting a global pandemic.
Well, thank you so much, Nirmal. We'll catch up with you next Friday. That was US Bureau Chief for the Straits Times, Nirmal Ghosh.
Well, back home, the welfare of foreign workers in Singapore is a hot button topic. We just discussed this extensively on the show earlier.
Paying tribute to these foreign workers here, our colleague Multimedia correspondent Yeo Sam Jo teamed up with his father Danny Yeo to record their own rendition of the popular classic Stand By Me. With Danny on the acoustic guitar, both father and son belted out what they titled Stand By You. Have a look.
Cry, always bowing through the tear. Now we say, let us stand by you. So my friend, stand by you. Oh, we'll stand by you. 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 Whenever you're in trouble, we'll be stand. One more time. By you. Oh, we'll stand by you. Stand by you. Stand by you. Stand by you. Stand by you.
The song is to rally Singaporeans to pen their messages of support for the foreign workers here. Now joining us now are the father and son duo Danny Yeo and Yeo Sam Jo to share more. Hi guys. Now guys, how did the idea come of doing a tribute to Singapore's foreign workers? We understand that both of you are no strangers to performing.
Yeah, we are not, but this really came about because my friend Melody, my dear friend Melody, she started this movement online, right? Singapore for Foreign Workers, or SG for FWS. So essentially, it's a campaign to get all of us to show some love and support to all the foreign worker friends. We know how badly they've been so badly hit by this COVID crisis. Okay, in fact, they've been the worst hit group, and it's just terrible what's happening. So we're using this as a launching point to kind of our video was basically part of this larger movement by SG for Foreign Workers to draw attention to their plight and to show that, and to basically let everyone who's empowered to change things know that we are very invested in their welfare, in the welfare of our foreign worker friends. Yeah.
So Sam Jo, you had the idea from, like you said, your friend Melody, and I suppose you got your father to lend a hand in this?
Oh yes, he came to me and said, look, we need to do a video, we need to do a song, to pay tribute to their foreign workers. So I said, okay, why not? I've always loved this kind of fun thing. And I said, when do we have to do it? He said, we need to do it in the next few hours. So it was a mad rush. I quickly wrote the lyrics and passed on to Sam Jo to refine it. And
I copy edited it because I'm a journalist, so I have to correct certain things in there.
And then because of the very tight timeline, I thought, hey, why don't we do Stand By Me? Because for two reasons. One, to change Stand By You, or rather to change Stand By Me to Stand By You is relatively easy. And also Sam Jo and I, we had performed this song together once, so we don't need much rehearsal. Just get the lyrics, shoot.
Yeah. To clarify, this deadline was my fault because I had known of my friend Melody had already told me about SG for FWS a few days earlier. But the whole idea of the movement was to collect 100 messages of well wishes and support for our foreign workers by this week. Which is why by the time Thursday rolled around, I was like, okay, Daddy, let's do something. And
very typical, last minute.
thank you very much telling everybody. But yeah, so these messages can be, you can do it too. You can send it in, you just write messages in text. You can post a picture, or you can do a video like us. We just wanted to be creative because we thought, why not, like, music like cheers everyone up anyway. So yeah, why not sing a song if we can?
All right. Now, Mr. Yeo, I understand that you have personal experience working with foreign workers as well. Tell us more.
No, not exactly working with them, but I always did notice the kind of work they put in, the way they toil and things like that. But just a month or two back, there was extensive road and drain work outside my house. And because I am a retiree, I spend a lot of time at home, out in the garden, and I observed them working, and it really hit me that these people are working very, very hard, right? Under the hot sun, they had very short meal break. Sometimes just see a packet of rice with curry on it when they eat, And so what I did was actually I went to the fastest shop and I bought some cartons of soft drinks.
Yeah.
I would chew them, put them in the ice box and put it outside my house. And I realized that they were so very grateful. So such little things that we do means a lot to them.
Yeah.
So,
yeah, definitely little efforts like that, and little steps, they do go a long way. Yeah. Well, thank you so much, Mr. Yeo and Sam Jo. Now we were speaking to father and son, Yeo and Yeo Sam Jo, who did a remake of the classic Stand By Me as a tribute to foreign workers here.
Now, in the sequel to the Straits Times' collaboration with local music veteran Clement Chow's music video, more than 15 children and youth have come on board the Stay at Home Singapore campaign. This will help raise funds for their peers from low-income families.
Your donations will go to support the ST School Pocket Money Fund and the Business Times Budding Artists Fund. Go to the link below to donate. It's also in the description if you're watching us on YouTube. Here's a teaser for the music video, which will be launching on ST's platforms later tonight. This is The Big Story. Stay safe, everyone.